Welcome to the lesson on Self-Care Heals Back Pain. This lesson focuses on those steps that you can do to immediately begin the healing process and get relief from back pain. Research has found that many specific self-care strategies can help you do this. Let me explain. For both chronic pain and mild to moderate acute injuries, Self-Care Heals routine will begin the healing process and relieve your pain sooner. You should begin this now. HEALS protocol stands for H for heat, cold, and massage, E for exercise, including stretching, strengthening, and normal functioning, A for analgesics, including anti-inflammatory, pain-relieving medications. L is for lifestyle, focusing on diet and sleep. S is for strain and stress reduction. So let's review each one. H is for heat, cold, and massage. This encourages relief and healing in the muscles and joints that are sore. For example, you could use moist heat packs by putting them in the microwave and heating them just right, not too hot. Or you can put cold packs in the freezer, take them out, and place them against the hip or the back. Or you can alternate heat or cold. Then, after you apply heat or cold, then do a gentle relaxation massage by just pulling down and massaging the muscles and joints in the area. You may also use deep muscle massage to reduce pain from myofascial trigger points. First, use your finger to find the tender muscle knots called trigger points that reproduce your pain. Then, use your finger, thumb, or a massage tool such as a knobble to massage the trigger point firmly for a few minutes. This hurts a bit, but also feels good. Then gently stretch the muscle. This will reduce tenderness and give you some relief from the dull pain. The next is up to you to reduce strain to the muscle during the day to prevent the trigger point from recurring. Now E is for exercise. Stretching the back keeps the spine muscles and vertebrae flexible, and it prevents bulging discs and pain. In this exercise, begin in a face-down position on the floor with your hands on the floor. Slowly straighten your arms while keeping the feet on the floor. Your lower back will be slightly arched. Push up to stretch, but not to the point of pain. Count to 10 and rest, and repeat this 6 times. Another exercise is stretching the hip flexor muscles. This will also prevent hip and back pain. It will improve range of motion, function, posture, and pain in the hip and back. In this exercise, lay on your back and pull the knee to the chest with your hands. Push this to the point of pain and not beyond. Hold it for the count of 10. Rest and then repeat 6 times. Then repeat with the other leg. Here's another exercise that can help back pain. It allows you to stretch the hamstring muscles. It improves range of motion, function, posture, and pain in the back. Sit down with one leg extended and the other leg bent at the knee. Grab the ankle of the extended leg and pull your head down as close to the knee as possible. Push to the point of pain and not beyond. Hold this for a count of 10, rest, and then repeat 6 times. Repeat with the other leg. A is for analgesics. The best analgesics to use for musculoskeletal pain is anti-inflammatories, or NSAIDs. They can reduce pain and inflammation quite effectively. Some of the examples of these analgesics include ibuprofen, aspirin, naproxen, and even placing topical analgesics on the skin will help alleviate the pain. Use this regularly for several days. It'll work quite well. Now the question comes up about, should I use opioids for my pain? We recommend avoiding opioid narcotic medications since there are a lot of concerns expressed about the safety of long-term opioid administration. As you'd expect, it can lead to adverse events, increased pain and tolerance to the analgesic effect, addiction, and even drug diversion. Most current pain guidelines do not recommend the use of opioids for chronic non-cancer pain, and they reflect the concern over these problems. Some people are on opioids or have expressed interest in considering opioids for the pain. It is important to note that opioids are strong painkillers. In one study, 42% of workers with neck and back pain received opioids at their first visit. However, 38% of them were still on opioids at 1 year and still had pain. In addition, systematic reviews of clinical trials have showed that opioids, when compared to anti-inflammatory medications, have similar efficacy. Yet the opioids have higher side effect profile than anti-inflammatories. It's best to stay away from opioids. Here are some of the side effects of opioid medications. As you can see, opioids had a much higher side effect profile than placebos. They had more adverse events. They had adverse events upon withdrawal, lack of efficacy, dry mouth, nausea, constipation, itching or pruritus, dizziness, drowsiness, and vomiting. Here's the big concern about opioids. Is addiction a problem? In the past few years, opioid use and the death rate from opioids have increased dramatically. Here are some of the numbers. Drug overdose deaths, 40,000. Unintentional overdose deaths, 15,000. Non-medical use of prescriptions, 12 million. Cost to insurers, 72 billion. Emergency room visits, 500,000. And total workers' compensation costs is about 15 to 20% because of the adverse events. L is for lifestyle. Eating well and sleeping well every night. With regard to your diet, eat a pain-free diet. This includes lots of water per day, 8 to 10 glasses. And your main meal should be large salads with lots of fresh vegetables and fruits. And have some protein, including fish, poultry, legumes. And brown rice, aged bread can be a good supplement. However, to avoid sugar to reduce inflammation. And reduce use of regular caffeine to avoid rebound headaches. And avoid excess of chewy foods for jaw pain. And be modest in alcohol, beer, and wine. L for lifestyle also means getting a good night's sleep every night. This will encourage healing and relaxation of the muscles and joints. Here are some suggestions on doing that. Make sure your room is dark, quiet, and cool. You'll sleep better. And make sure your mattress and pillow is comfortable and medium firm, and the pillow supports your head without pressing on the jaw. And then get plenty of exercise and no naps during the day. This will make sure you're tired when you go to bed. And then practice calming before bed. Try to avoid exciting books or television shows before bed. And natural sleep aids occasionally can be helpful, but do not do them on a daily basis. Finally, S is for strain reduced. To encourage healing, it is important to reduce repeated tensing habits that put strain on the muscles and joints. For the hip, this means reducing prolonged sitting or repeatedly lifting heavy objects, or stiff joints in the hip, knee, and lower back, with a lower level of fitness, strength, and flexibility, or flat feet and overweight, and weak buttocks and core muscles. And also reducing repeated sprints, kicks, or raising the legs, such as cycling or martial arts with athletes. Each of these can contribute to continued pain within the hip. S also means reducing strain from poor posture. It's important to maintain a balanced, relaxed posture in standing and sitting. There's a number of poor postures that can cause hip pain. For example, the anterior pelvic tilt. This is a postural problem where the butt sticks out and the gut protrudes. It occurs to those who sit a lot with poor posture. Sitting posture means that the hips and buttocks are back against the chair, and then lean back into the chair with your head up and shoulders straight. Good standing posture means the shoulders are back, the head up, the gut is tucked in, and the pelvis is rotated up. It's important to strengthen the abdominal and gluteal muscles to prevent hip and back pain. In addition to reducing direct strain to the muscles and joints, it's important to reduce overall stress. You need to learn to cope with resilience to stressful events. You kind of got to go with the flow. And then reduce muscle tensing when you're under stress. Take a deep breath and practice calming. And then finally shift from negative emotions. First of all, be mindful of your emotions throughout the day. Take a quick pause to determine them. And then shift to positive emotions through creative actions. These are all reviewed within other lessons. It is important to realize that self-care does heal pain. So follow these self-care guidelines. Try to follow them on a daily routine. You'll notice that pain will improve gradually, but will fluctuate up and down. It'll get worse and it'll get better, but gradually improve. And make sure you identify and reduce risk factors and boost those protective factors and actions in the 7 rounds to improve long-term healing. You can learn all of this from the lessons ahead.